Next on SutterHealth Life Stages, are you shouldering some heavy pain?
I had no idea how many women were dealing with this until I got injured myself.
Why you don't want to ignore that shoulder ache. Exam time. Have you had this test?
This is an opportunity to save women's lives.
How to help your guy stay healthy.
He eats better. He does also exercise.
Some ideas that really work. Plus,
if you know how to order off a menu, this can make a huge difference to your health.
Do you like to feel the effects of your workout as you go on through the rest of your day? Hi, I'm Beth Ruiak, and welcome to SutterHealth Life Stages. I have news for you. A little reminder is okay.
You know that fitness philosophy, no pain, no gain? That is so old school. You know, if you're having to reach for the pain pills between every exercise, chances are you could do it with a few simple stretches and a few things to really ward off that pain. Keep yourself injury-free. For instance, if you're having shin splints, that pain right in the front of your lower leg area, that could be because you need to walk on your toes and your heels. So walk on your toes for about a minute or about 30 steps. This really strengthens your calf area. Alternately, walk on your heels, heel walk. That really helps take a lot of that burning out of the front of your foot. Another way to really ward off shin splints is to find a stair or someplace that you can do a calf stretch. This feels so good. You put your heel down as close, put your heel in and close as you can to a step or some other slight lift, and lean into it. Really feel that stretch, really from the base of your behind all the way down through your Achilles tendon. Another great one for your quadricep area is to, you can hold on to something, just raise that leg up. It gets a great front of the leg and thigh stretch. You know, the whole idea here is not to work out one day and spend the next 5 days on the couch. The idea is to do something physical and active every day. A few simple exercises, you'll be well on your way.
Those phrases like no pain, no gain and feel the burn, those were born out of the 80s fitness craze, but athletes have since discovered that those mottos don't necessarily hold true. Okay, ladies, time for a little bit of girl talk. Has it been a while since you had your last mammogram? Here's some motivation to make sure that you keep that appointment.
Breast cancer is the most common non-skin cancer in women. It affects all of our lives. It's estimated that over 180,000 women will be newly diagnosed with breast cancer this year alone in the United States, and thousands of them right here in Northern California. And while those numbers are alarming and concerning, the good news is that breast cancer is highly curable when it is detected in its earliest stages. That's why screening for breast cancer is so important. Right now, mammography is the only screening test proven to decrease deaths from breast cancer in clinical studies. So if you haven't had your mammogram in a while, we'd like to invite you to come on in.
I'm going to explain what we're going to do, and no, it will not hurt.
A mammogram is a very specialized X-ray image of the breast performed by a highly trained technologist. It creates a high-resolution, very detailed image of the breast tissue, which we search for any changes or tumors that may be cancerous. It takes about 15 minutes. It may be a little bit uncomfortable, but it's highly worth it. This machine has saved many lives.
Wow, this is nothing.
Think of it this way. A mammogram is an opportunity for early detection of breast cancer, to halt the natural progression of this disease, and to possibly save lives. So when was your last mammogram? If you're overdue, this is your personal invitation to come on in.
Want to know if you could benefit from a digital mammogram? You can find out at LifeStages.org.
Aches and pains in your shoulder? Don't brush them off.
It's easy to try and ignore this type of injury, but trust me, it's not a good idea.
Change happens. Now you have a personalized health resource that can change right along with you. My Life Stages, created just for women. Online and in your community. Learn more at mylifestages.org.
Dr. Tom. I've heard recently that skin cancer is on the rise in women, but not in men. Is that true? And how much is too much sun exposure?
According to the American Cancer Society, almost 1 million cases of skin cancer go unreported and thus untreated every year. So this is a very important issue. More than 7,000 new cases of skin cancer are diagnosed each year here in sunny California. We know that skin cancer is on the rise in younger women, mostly in their 30s. So this is a sign that we do need to pay more attention to our sun exposure. A little bit of sun is healthy for most people. It's actually a great source of vitamin D. There's not a lot of conclusive research, but some studies show that 15 minutes 4 times a week gives you as much of the vitamin D your body needs. Research shows us that more people in the U.S. are getting sunburns in general, although trends of age groups are not reported. And remember, tanning beds can be just as damaging as sun rays. That was a great question. For more on this issue, visit us at mylifestages.org.
Carrying a purse, carrying a gym bag, you wouldn't believe what can cause shoulder problems. You are about to meet a police officer who found out personally how quickly a shoulder injury can get out of hand.
Barbara Schumacher, she says call her Barb, is crazy about volleyball. She's been spiking, stuff blocking, and acing serves since high school. Even went pro after college.
Made the Final Four, NC2A Final Four, 3 out of our 4 years. Won a national championship in 1981. See that hand right there?
When Barb isn't slamming a volleyball toward an opponent, she's slamming handcuffs on bad guys.
I am a police officer here in the Sacramento Valley.
Now, given Barb's active lifestyle, you'd think it would be just a matter of time before she got hurt. But it wasn't her job or her sport that brought her down. It was one of her best friends.
Suki, she's a border collie.
Suki's a sport buff too. She loves to run, especially when the backyard gate gets opened.
I'm in the middle of the driveway. The dog comes running down the driveway at full speed, and as she comes by me, I reach out and grab her, and when I grab her, she yanks me across.
The power of the pup pulled Barb down into a flower bed, tearing a tendon in her shoulder. But as someone with a high pain threshold, Barb continued to work and work out for months.
That's when I kind of thought, oh, kind of like my other athletic injuries. You know, I'll just work through it, and months go by and it didn't get better. One day I went to make an arrest, and I couldn't even reach my handcuffs. That's when I knew that it was time to see a doctor.
When Barb checked in with SutterHealth orthopedic surgeon Alan Hirahara, she learned that active baby boomers are quite susceptible to shoulder tendon tears. The doctor offered this analogy.
Let's say you have an old pair of jeans, and you've been wearing it for a long time. Someday you just happen to get up, and you just notice there's a tear all of a sudden, out of nowhere. It's the same principle. Sometimes the smallest little bits of trauma can cause these tears.
Many of Dr. Hirahara's female patients are surprised to learn that in addition to impact injuries, there are overuse injuries which stem from daily habits.
I carry everything on my left shoulder. And it also kind of goes to a lot of women, a lot of kids, students carrying backpacks on their shoulders. That's what I was doing. I was carrying all my gym bags, all my equipment, everything on my left side.
The good news is technology offers relatively simple solutions to many shoulder injuries. Barb's treatment involved a minimally invasive procedure done with an arthroscope. Tiny tools are inserted into the shoulder through a small incision.
Go inside with a small camera, be able to visualize the problem and actually repair it where it is.
The hour-long surgery is now an outpatient procedure, meaning no overnight stay in the hospital. Barb's full recovery took several months. During that time, she learned how to strengthen her shoulder muscles using smaller weights.
This is only 5 pounds, but a lot of women think, well, you know, I can't do that. I can't lift 20 pounds. Well, you wouldn't want to lift 20 pounds for a small muscle like your shoulder. So doing this, I really was able to develop my shoulders after surgery just by doing 3 sets of 12 of these, of, 5 pounds.
Dr. Hirahara agrees and says the low-weight, high-reps approach is a great way to prevent shoulder injuries and keep them from recurring.
She looks great. She's doing very well. She's able to maintain her job well, and that's a hard job.
Now that Barb's back in spiking form, she's changed her mind about how to approach a nagging injury.
You're thinking, why didn't I do that a year ago, or however long it is that you've put up with it, rather than just putting it off. Get it taken care of so you can move on.
Is your shoulder trying to tell you something? If that pain doesn't respond to anti-inflammatories, it's time to have a doctor take a look at it.
Men's health and fitness.
I think he's more health conscious in eating right than I am.
How women can help keep it a priority.
Okay, Tuesday at 10 a.m. You'll be there? Okay, bye. Do you have a guy in your life who doesn't put taking care of his health on high priority? My husband's pretty good about it, but I've been asking women how they help their guy keep it on the to-do list.
When women and men team up on health issues, the results can be inspiring. There are many ways that we as women can partner with our guys to keep a focus on health. Women I've interviewed recently have shared some of their ideas and strategies. Here goes.
I tend to like to grab recipes out of health magazines that are easy and quick that not only I can do, but also the kids or my husband can put together for them. And when I'm shopping, try to make that list and have more of the healthy items that are there for those recipes.
In my life, it's my job to make sure all those things are available. Grab the fruit, veggies, whatever, have everything cut up, simple things like that, just doing all the prep work so that my husband can grab his lunch and go to work and not have to worry about packing it and maybe getting something that's not as healthy.
I think when our team formed, we started thinking of it as a social activity, and then we kind of got our husbands and children involved, and now it's just part of our lifestyle.
Well, I had been a recreational cyclist. My husband and I had cycled together prior to having kids. When you are passionate about something, it's easy to stay involved with it, to stay active with it.
Recently, we were able to have the same doctor, and it's absolutely wonderful because I can talk to my doctor about my husband, and then he can in turn say the things that I can't say to him that he needs to know about his health. We have computers. A computer sheet reads out exactly what you need to have done and what you've had done recently.
I want to keep my husband healthy because he's in his 70s, and I'd like to at least reach our 50th anniversary.
Oh, you're doing a good job out there, buddy.
When we first were married, he didn't go to the doctor, and now he goes on a regular basis, thanks to me. But he has a really good relationship with our physician. We all go to the same doctor, and we have a wonderful relationship with him, and that's real important.
If there's anybody I can rely on, if there's anybody that's going to pick up the slack for me, it's Connor. And he is absolutely my rock. He's not a stress. He's the stress reliever.
He actually teaches yoga as well, my husband does. So he gets to exercise all the time, so he gets the endorphin release all day long. But fortunately for us, he is actually the one who really opened my eyes.
I was diagnosed with Epstein-Barr virus.
Did your impetus in taking care of yourself prompt him to do better for himself?
Yes. Yeah. He eats better. He does also exercise. He does yoga. He's very flexible. And so, but I know my exercise is getting him to get out the door and do his too.
I knew this man, and he had just retired. And he was the CEO of some large hotel chain. And he said when he retires, what he wants to do is learn to play an instrument, learn a language, and learn to paint, because that's what will keep his mind young.
When my husband and I were young, we'd go on a vacation and we'd see older people, and that's all they would do, would talk about their health. And my husband would say, well, I hope we're never doing that. But, you know, we've changed our minds because it is important to continue talking about your health with your friends, because sometimes you learn something that you didn't know about.
Thanks to all the women for their great comments and to their guys for letting us talk about them. And now here's Dr. Tony Breyer with more advice on taking care of the men in your life.
Just like women, men have preventive health needs,
that require screening tests based on their risk factors. And it's a really good guy that has a woman or a partner who can help him remember when it's time. At different men's life stages, they need different things. When they're younger, we do testicular cancer screening. As they get older, we do prostate cancer screening. I tell my young patients that they should be doing testicle checks every month, just like women do self-breast exam. Women are often the keepers of the family history, but it's also important for men to know their health risks and family history too. Look, we should all be helping each other keep on track, even if it takes a little nudge from time to time.
Hi, Dr. Tom. I'm curious, does menopause really trigger migraine headaches?
Many women who suffer from migraines tell us their headaches seem to be tied to their menstrual cycles. So here's some good news and some not so good news about the role of menopause and migraines. First, the good news. For some women, menopause may actually make your migraines less severe. If you suffer from migraines as you get older, the nausea that can come with these headaches can also decrease as well. But here's the not so great news. There are cases where in some women, menopause can trigger migraines. It's not clear why this happens, but hormone replacement therapy is believed to be a link. Generally speaking, though, for women, the worsening of the migraine symptoms go away once menopause is complete.
Dining out doesn't mean your health has to take a dive.
If you know how to order off a menu, you can make some great changes to your health.
It happens. Now you have a personalized health resource that can change right along with you. My LifeStages, created just for women. Online and in your community. Learn more at mylifestages.org.
Let's have another viewer question, this time from the web. Teresa S. writes, Dr. Tom, is it normal to need less sleep as you grow older? A study supports that as we age, we need less sleep. You see, researchers put people in various age groups in a dark sleep lab for 16 hours. The younger people got an average of 9 hours of shut-eye, and folks over age 60 only needed an average of 7.5 hours of sleep. As we age, our sleep often becomes more disrupted as well. Our susceptibility to insomnia increases with age for reasons that aren't entirely clear. The important question to ask is, do you feel rested? If you don't feel rested at the end of the night and ready to greet the day, it may be time to talk to a sleep specialist. What's your health question? Visit us online for a chance to have it answered on the air. Plus, at mylifestages.org, you can also post questions for doctors to answer online.
Do you know your Ayurvedic body type? According to ancient wellness practices, knowing this can give you valuable information to live a healthy life.
When you go to the doctor's office, you might think of yourself as a patient with chest pain, someone with a headache, or someone with back pain. You define yourself by your illness. But in Ayurveda, an ancient system of Indian medicine established over 6,000 years ago, things were very different. Shall we take a look? Water, earth, air, fire, and space. These are elements that make up our universe. These are also elements that make up our body, which is in harmony with the universe. Sel, what brings you in today?
I can't sleep, Dr. Judge.
Looking at the unique and individual nature of each patient, we determine what is out of balance with the universe, and bringing that into balance brings health. And then just kind of taking a deep breath in and out through your diaphragm and out, and then another breath in and out. And then do that for about 10 minutes before you sleep every night and see if that relaxes you enough. Every person has characteristics of one of 3 doshas. These doshas determine your wellness, your illness, and your susceptibility to illness. Each dosha has a unique set of characteristics. The Vata dosha represents air and space. People who are Vata may be thin, with active eyes, and are lively and enthusiastic. Pitta dosha represents fire and water. Patients who are Pitta may be of medium build, with a clear gaze, and they're purposeful and intent. Kapha dosha represents water and earth. These people have strong frames, with warm eyes, and are easygoing and nurturing. Most individuals are combinations of each of these doshas, but generally most individuals are one dominant dosha. An Ayurvedic practitioner, when he's looking at treatment for an illness, will focus on a few things. He may make food recommendations, give Ayurvedic herbs, medications which are Ayurvedic, or a treatment would be yoga. Yoga is the physical therapy 6,000 years ago, which we still do today. So the basic principles about Ayurveda are remembered wellness, that we were all born healthy, and that when we get ill, it's actually a departure from the health that our bodies still know. To get over the illness, all we do is go back to the wellness we've always known. Those principles were very true 6,000 years ago. They're also very true today.
When it comes to eating out, the world is your oyster. There are so many tempting choices now. It's easy to derail your health, but you don't have to. Here's how.
Double barrel ale, barbecue sauce, jack cheese. I love reading menus. Burgers, steaks, salads. These are questions my clients ask me. What can I eat when I'm going out?
Doesn't have cheese in it.
The spinach salad looks good.
So here's a really easy rule of thumb. Half the plate should be vegetables, quarter should be starch, and the other quarter should be protein. So if we draw this really easy analogy into, say, a Chinese restaurant, think about having something with a vegetable base, maybe bok choy and broccoli, some cashews and chicken, and maybe a little bit of rice. So what about Thai food? Well, I love coconut Thai curry. And the coconut milk in there is really healthy. You know, we used to think that coconut was so bad for the body. What we now know is that it isn't. In fact, we're looking at the research, it actually increases the healthy benefits of the HDLs, the good guys, the good cholesterol. Let's take that into a Mexican restaurant. How about ordering a burrito bowl instead of a burrito? Beans, veggies, and you don't have all the carbs. It's remembering the plate. Half vegetables, quarter starch, quarter protein. Bon appetit.
Many restaurants will make low-calorie versions of their menu items for you. All you have to do is ask. Thanks for joining us. See you next time.